You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Hi everyone, this is Tony Dow and welcome to another episode of Pharmacy IT and Me. As with every episode, we start off this one stating that the intended audience for this episode are newcomers to pharmacy informatics or technologies. So today's episode, we're actually not going to be focusing on pharmacy-specific informatics-related items because I wanted to change things up a little bit. Instead, today we'll be speaking a little bit about different types of networks that exist out there. You'll run into these acronyms at some point, and I think it's really good to know, or at least kind of know what they are, and how they are used in healthcare IT. So let's get right into it. The first acronym I wanted to talk about is LAN, L-A-N. So LAN or LAN stands for Local Area Network. A local area network is a computer network that spans a relatively small area, which is usually all the computers in an institution or a company. For example, when you're working at a hospital and all the computers in that hospital are able to talk to each other, it's likely that they are all computers connected to a local area network. These can be connected through Ethernet cables or through wireless radio technologies. Routers and access points are also important in this type of network. The next type of network is called a WAN or WAN, and it stands for Wide Area Network. And typically this spans a much larger area like a city or even around the globe. You can kind of think of a WAN as a network that's capable of connecting LANs together. So WANs can be used to connect two different hospital LANs together, for example, if the hospitals are supposed to be in the same health system network. So WANs require leased lines or internet technologies with VPN services to work appropriately. There's a halfway point in between the LAN and the WAN, and it's called a MAN, M-A-N, and it actually stands for Metropolitan Area Network. And it's not often talked about because sometimes it's a little bit difficult to determine just what constitutes as MAN, since the coverage area is a little ambiguous in the definition. Now, when you are working with healthcare IT systems that use a lot of storage, like, for example, electronic health records, you might also hear the IT folks mention something called a SAN. SAN stands for Storage Area Network, and this is a collection of high-speed hard drives that are interconnected with servers. These networks help make storage units and storage servers look like they are locally attached to network devices, even though they are technically network storage centers. The next one is a CAN, which is a Controller Area Network. And I know these acronyms are starting to sound funny, but it's a network that allows smaller things like microcontrollers to exist and communicate with each other and other devices without needing to have a host computer. And you may see this kind of controller area network in certain medical instruments or robotic medical arms. And a MANnet, not to be confused with MAN, is a mobile ad hoc network. This is a type of mesh network, and a mesh network means all devices are connected to all devices. There's a lot of built-in redundancy with the structure of a MANnet because if any one device fails, you have several backups for data to continue to be transferred through message forwarding. A PAN is a personal area network, and this is also called a BAN or body area network or even a PicoNet. So this is when you are using devices that are very, very locally connected to you. So by local, I'm talking about surface sensors or even bodily implants. Devices that can be implanted into you or, devices that are sensors on your skin. If they communicate through wireless technologies to your phone or a nearby computer, that's the very small local network around you, and that's called a PicoNet or a PAN or a BAN. Individuals who use EKG monitors that sync to their phone or body sensors that sync to a local device are typically using a PicoNet. And finally, a GAN is a Global Area Network, GAN, which is a network that supports pretty much every mobile device or, mobile computer that you can think of through wireless LAN, satellite technology, mobile cell towers, and others. Global area networks have implications in health mostly because a lot of mobile health apps would benefit from being connected to the internet at all times. So hopefully you learn a little bit more about the technical side of things in today's episode, and let me know if you enjoy these kind of more technical episodes, since once in a while I want to take a break from the pharmacy informatics side because I think it's actually pretty important to understand some technical definitions. So at least you're being familiar with what they are so you can kind of understand what's out there to ensure that you're using your pharmacy informatics tools efficiently. Alright, if you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or Instagram at Pharmacy Informatics, or by emailing me at tony@pharmacyitme.com. And I also wanted to plug a great networking opportunity called Pharmacist Connect. If you are familiar with Microsoft Teams or Slack Workspace, think of Pharmacist Connect as a large vetted one through Slack Workspaces. I've met some great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy ITME. And remember, technology is the tool, patient care is the goal.